Hello, I'm Toya Bresky from Galveston, Texas. My Facebook and X page is Galveston Psychic Paranormal Researcher. I'm also on Instagram and under Facebook as Toya Bresky. It's about 2:30 in the morning on Hi, I'm Toya Bresky from Galveston, Texas. My Facebook and X page is Galveston Psychic Paranormal Researcher. I'm also on Instagram or on Facebook under Toya Bresky. It's 2:30 a.m. on Monday night, and it's the day before St. Patrick's Day. Now, some of you who have read my post know that I'll be spending St. Patrick's Day at University of Texas Medical Branch having very important breast diagnostic testing. I've already went through a breast MRI, which showed multiple masses bilaterally on both breasts. Also, I had a previous surgery 35 to 40 years ago where I had breast lumps and I had 2 lumpectomies. Because of that lumpectomy on my right breast, I had to have mastectomy implants for symmetry. So, about a year later, after I had those implants put in for symmetry, I was told that the implants had been recalled. And I was told that there was a lawsuit that I could be involved in, that I could get a settlement, I could have the breast implants removed. But at that time, at my young age, money didn't mean anything to me. And I didn't want to go through another surgery. And so I opted to keep the breast implants in my body. I wasn't really having a problem, so I didn't feel at that time that I needed to remove them. So as the years passed, I really didn't have any issues that I was aware of. But now I'm 61. So last year when I turned 60, I started to notice that I was having some issues. Mainly, I started to have like a sweat that was between my breasts, and it was unusual to me because I'm not a person who sweats a lot. And so at first, when I began to have this kind of sweat, I thought, well, I've gained 50 pounds. I'm just a fat old woman now. And it's probably just something like I'm sweating too much because my body has changed, and hormonally, maybe things have changed. So for a couple of months, I bought something like Lumi deodorant, which is the body deodorant that you can use anywhere. And I started putting Lumi deodorant between my breasts because that was where there was this type of leakage or just heavy sweat. So I tried that for a couple of months, but then the situation got worse and worse, where the Lumi deodorant was no longer controlling the amount of moisture between my breasts. And then something worse happened. I began to get an odor between my breasts. And at that point, it was really a problem where I was going to the bathroom at least 4 times a day at work, washing between my breasts with soap and water because I was afraid that the odor could be smelled by other people. And so Um, at the time, I did not have insurance with my current job. Now, previous to that, I was a state of Texas employee. I always had fully paid insurance. But at my current job, I did not have any insurance, so I just kind of chalked it off as this is something that I'm going to have to deal with. I'm older now. I'm just sweating too much. You know, it's just something like has to do with me gaining weight. It has to do with me getting older. So a couple of more months passed where I was doing all of that, using deodorant, washing between my breasts, putting on deodorant again. And then the problem got to where I was putting paper towels in my bra because oily leakage was coming out of my breast. Really kind of like a clear but brownish red tinged discharge was coming out of my sternum. Not out of my breast, but out of the center of my breast, kind of centered and under my breast, kind of like a upside down T. So at that point, the odor had gotten really strong where, I hate to say this, but it was like the smell of rotted meat, like terrible. So at that point, I was like, whatever I do, I have got to get to a doctor. So because I didn't have benefits at my regular job, I applied for healthcare.gov. And I knew that this is going to turn into something that is probably not good. So I went to a surgeon right off the bat. I didn't even go to a primary care doctor. And what I told her was I thought that the implants had probably ruptured, because at this point it didn't feel like sweat anymore. It was like a slimy, sticky discharge that was coming out of my chest, but not my breast. So I really wasn't worried about any other thing. And in fact, I kind of joked about it. I said, well, it's probably just the implants, the mastectomy implants that were put in that finally ruptured. You know, so I went for a breast MRI, and a breast MRI is very different than any other MRI. You have to lay in the prone position, laying on your stomach, with your breast hanging into a basket, face down, and you're in there for at least an hour. Well, I was in there for an hour and 15 minutes because in 2021 or 2022, I had COVID and I was out of work for 28 days because I was so sick with COVID. So my lungs have never really healed. So the whole time I was in the MRI machine, I have to take deep breaths, especially laying on my stomach. I was moving around a lot. So they kept saying, well, you moved. We're going to have to do this over. It was terrible. So anyway, I went home that night and I was sort of in a happy mood still, just sort of, you know, like joking at myself and saying things like that all of this was probably my imagination, that they're going to have nothing wrong with me. The test is going to come back and say normal findings, that absolutely nothing is wrong except that I've gained weight and I'm fat and I'm sweaty. But I got an email that my test results were back on my chart. And so when I opened it and I read it, you know, I had joked about that the mastectomy implants have probably ruptured. And I was exactly right. Both implants, bilaterally on both sides, have ruptured. And so at the time they were saying that it was intracapsular, meaning that even though they are leaking, that there's a capsular like pocket that the silicone is staying in, which was hard for me to believe because the silicone or something was leaking out of my breast plate. Now, what's concerning about it leaking through the center of my sternum is there's also a lot of lymph nodes that line up right there where the leakage is. So lymph nodes can also leak. So as I read my report more, I started to cry because the report said that there were multiple masses in my breast, bilaterally on both sides, that both breasts had multiple masses. Now, my mother is a breast cancer survivor. She's still alive. But I immediately had terror, like complete terror, complete anguish, like, oh no, like, what does this mean? And so they ordered a new diagnostic mammogram, which is called Tomosynthesis, like Tomosynthesis. It's very hard to say, but it's a 3D mammogram, which is different from the standard mammogram. Sorry, that's very hard to say. And then they ordered a ultrasound, but because the tomosynthesis is very backed up, it's not offered in a lot of places. I had to wait almost 2 months to get an appointment just to get in to have that, like maybe a month and a half. They got me in as soon as they could. But, so that test is tomorrow, the 3D mammogram and the ultrasound. I've had anxiety and anguish for weeks now, especially in the past week, knowing that I don't know what the results of these tests will be. And I have so much anxiety about what does it really mean. Like, after this test, I know the reason for this test is because they have to map out where each mass is so that they can later be biopsied. So even after these tests, then I'm going to be scheduled for a biopsy. I already know it. Just this month alone, I've had to pay $1,500 in copays for all these radiology tests. Even though I have health insurance, it's really broke me for the month. So then when the biopsy comes up, that'll be another fee. And then I am absolutely facing surgery no matter what, because we have to remove these ruptured implants. Now, in the past week, I was having a lot of leakage out of my left breast. My surgeon wanted me to come in immediately, like ASAP, come in, Toya. I need to look at that. But because I can't afford to miss even a single day of work, I was just going to suffer like another week till my next payday. So I called to cancel the appointment and try to make it like a week later. But then the doctor's office blew up my phone and they kept calling me, trying to stress the urgency of me coming in. And they were like, if you miss Friday, please come in Monday, the same day that I have all the hospital tests. So tomorrow I have the 3D mammogram, the tomosynthesis, and the ultrasound. And then in the afternoon, I have to be at the surgeon's office. Now, there's so many worries going through my mind. It's hard for me to even talk about it. There's so many things that come up, like I wonder, even if the masses in my breast turn out to be benign, because there's so many of them, does that affect me being able to have a replacement implant put in my breast once they take out the ones that are ruptured? If they find cancer, then what kind of surgery options do I have to look at? Because my idea of what's going to happen is that this is benign, that they're going to cut underneath my breast where the original scar was, and they're just going to pull out these ruptured implants, which are now flat. This is my breast size. The implants were underneath the muscle, but they have completely flattened out, and they're no longer really causing the shape of my breast. So this breast size here is my natural breast size now. So this is a D cup. There's a lot of things that I'm thinking about, like I would want another breast implant put in my breast, or I would want fat put in my breast to retain the roundness and the size. It's still very important to me aesthetically to have nice looking breasts. Now, they showed me videos of breast reconstructions should I have cancer. I didn't like any of those options. I hated the scarring on those operations. It was very scary. In fact, I almost went MIA as soon as they showed me the videos of those surgeries. I was like, this is just terrible. And my mother did not opt to have breast surgery. My mother had radiation. Now, I'm going to be real honest with you. I don't want to take chemotherapy. I don't want radiation. I don't want the patch quilt scars on my breast that they do for breast reconstruction. On a lot of breast reconstruction, the scarring is just really unattractive. They have these scars that come vertically up to your nipple, and then sometimes they cut off the nipple and they replace them somewhere. Or there's a surgery that they presented to me where they cut out the flap of your stomach, which I could use a tummy tuck, but I don't think I want to go through that much cutting on my body. But what they do is they take the skin from your abdomen and they rebuild a breast, but then the scar is so ugly on that, it's all the way around the breast where they sew on the tissue from your abdomen. And I thought, no way, I do not want to do that. So when I go to my surgeon tomorrow, one of the things that I want to ask her is, can we still, no matter what, whether this is benign or cancerous, can we still stay with the under the breast incision? And probably so that I can maintain the roundness of my breast, because they will probably have to take out more tissue when they cut out these tumors or these cysts. So if that's the case, that they have to remove tissue, I would probably want, instead of a implant underneath my muscle, I would probably want them to take out the one underneath my muscle and then put a implant on top of the muscle in my breast. And so really, there's so many things that you have to think about that it's confusing. It's very stressful. I don't know how long this will take. I never, ever wanted to have another breast surgery. In fact, right now, you know, even with the breast implants being busted, I still have very nice breasts. Breast density runs in my family where we have very thick, dense breast. Now, there's a downside to having dense breasts because your chance of breast cancer actually increases the more dense your breasts are. So cosmetically, it might be a wonderful thing, but medically, it is a risk. Like I said, I'm unable to sleep. I'm just probably going to stay awake the whole night until my 8:30 appointment in the morning. Some of the things that are embarrassing is I worked at University of Texas Medical Branch for many years. I worked there as a EKG technician, as a telemetry monitor in cardiology, as a EKG specialist, and also I worked at the same hospital as a state of Texas correctional officer. So I know nearly every person in every department. So this is very embarrassing to me because basically for several hours I will be laying with my breast exposed. And I know the people who are doing these tests. Now, because my family has a history of fibroid tumors and of cancer, I'm having several scans. I'm having abdominal scans. In fact, I had that last week in my upper stomach. On Tuesday, the 18th, I'm actually having a pelvis transvaginal exam. And that is where they do an ultrasound of your abdomen to look at all of your organs in the lower abdomen. But they're also looking at your female reproductive organs like your uterus, things like that. And the transvaginal is where they actually put a wand into your vagina, and then they are scanning and looking at your fallopian tubes, your uterus, your cervix, all of those kind of female organs. Now, they told me drink 48 ounces of water for that test. Now, I'm thinking that has to be for the pelvis view, because I think the transvaginal one says that your bladder has to be empty. But anyone who knows me knows, okay, I'm always drinking big gulps. So typically for me, if I drink one big gulp, you know, like a Circle K giant, like Dr. Pepper, I'm going to have to go to the restroom like every 2 hours to pee. Now that's sipping on that just a little bit throughout the day, and that one will last me all day. But if I drink 48 ounces of water before this test, I'm going to have to tell them they're going to have to put a sheet under me, or they're going to have to bring a mop for the floor, because I don't think that I can hold my bladder for 30 minutes or an hour if I drink 48 ounces of water. I think that's just not going to happen. I'm going to have an accident. And then I'm really going to be embarrassed. But so I was talking to a friend today that I work with that used to work at the hospital also. And I was telling him, I said, you know, I'm really concerned about this because I know everybody and I really don't want to pee on the floor or pee on the table, but I cannot hold my bladder. I just can't. And he was like, you know, they see that all the time. You just have to be honest with them. You just have to tell them before the test, look, we got to hurry up with this because I can't hold my bladder for very long. So, this is going to be difficult. I don't like having to go through all of this, but here I am in this situation. Sometimes in life, we just have to take one day at a time. I am not prepared to hear that I have cancer. That would be devastating to me. And I know my doctors will probably get really angry with me because I'm not a person that believes in chemotherapy or radiation. I do not want to have a total mastectomy. I really feel like I would be the unconventional patient that's going to take fenbendazole and ivermectin or move to a state that allows cannabis treatment because I believe in the healing power of cannabis. Now, I've never used drugs. I don't even drink alcohol. I'm not a smoker. I can't stand the smell of marijuana. But if I had to take cannabis oil every day, I've heard so many uplifting stories about the healing power of it that I truly believe in it. So I hope that I never have to face that journey. I hope that this turns out like there's a specialty care team that is meeting me tomorrow, which is fellow radiologists. They're all going to be looking at my 3D mammogram and my ultrasound. I hope that they look at it and they say, you know what, we don't really feel like there's anything that important. We're going to send you for the biopsy because they have to do that. But we really feel like this is just cyst or fibroid conditions, and there's no big worry. And I hope that's how it turns out. I hope that everything goes smooth. I can just have these ruptured implants taken out, put new ones in, recover from my surgery, and all is well. I hope that's what happens. I don't want to sound superficial, but, you know, even at 61 years old, my breasts are still important to me. Really, I kind of use them like extra arms. When I go to Lowe's or I go to Home Depot and I can't hold everything, you know, I use them like appendages. So I'll put something over here, something between them, something over here. And then I've got my arms full of products, and they're really helpful in that way. Now, I have not been sexually active since 2008. That was 17 years ago. So, nobody has even seen my breasts. But I see them, and they are important to me, and you never know. Even at this late stage in my life, who knows, I could end up in a relationship later. So, there's a lot of things as a woman. I'm very, very feminine. I wouldn't want to take chemotherapy because I love long hair. My hair is very important to me. My hair is almost to my hips. And I just have it straight today because I'm just hanging out at my house. But I don't mean to be superficial, but to a person who's very feminine, hair means a lot. I've always loved long hair. Even my grandmother had hair to her calves until she was in her late 80s. Now, I really do not have any idea what's going to happen with all of these tests and what's going to happen with my doctors recommending things that I may have conflicts with. For instance, when they do breast biopsies, I'm just sharing this because a lot of people don't know these things, but I have been Googling and reading up on everything that is going to happen. So during a breast biopsy, they use numbing cream before they inject needles into your breast. I'm still scared. But one of the things that I don't like about that is they have these little clips that look like X's. And at the end of the needle, they try to mark each mass with one of those tiny little markers. And I'm not sure if those markers are metal or if those markers are plastic. But regardless, it is putting a foreign body into my breast, and there's a chance that those things could migrate. I don't like that idea. And so already, as far as having the biopsy, I have worries and I have a conflict with how they do the biopsy. Now, I don't know. Oh, actually, somebody told me today. They said that in their biopsy, they didn't use the little plastic or metal markers, which are shaped like a tiny little X. That they used a type of tattooing that stays in the body for just a short period or duration. But the dye actually marks each mass that is in the breast. Now that sounds a lot safer to me. So when I go to University of Texas Medical Branch to the breast imaging, I'm going to be asking them, when you do my biopsy, will you be using dye or are you planning on using these markers? Because if I have a choice, I would like the dye used. So I know that I could be private about what I'm going through, but I hope by sharing my stories of each thing that I'm going through regarding breast health, that it helps somebody. And even though I'm not 100% on the team of chemotherapy, radiation, or mastectomies, I'm being honest about sometimes there are people who are more holistic in their approach of how they want to heal from an illness. And so for me, I would want to look at more holistic ideas of how I could heal if this turns out to be cancer. Hey, I will take dog medicine. I will take dog dewormer. I will take it. I will. My brother and I are already talking about ordering this. And you know what? There are cases of human beings that were in stage 4 cancer who have healed themselves by using these anti-parasitic medications. So I believe them. And I would be that person that would want to be experimental and do that. I'm going through this alone. I am glad that I have had my brother and my mom. My mom, can't travel around a lot because she's in her late 80s. My brother has his own medical issues. He's had like 6 back surgeries. But this is not something that every day you can sit down with someone and just say, you know what, I'm really scared. I'm really worried. I'm really stressed out. I'm in anguish, worrying about all of these things. Not only that, just surgery itself is a risk. It's a lot for a woman to go through. The funny thing is my brother was telling me a story about, families have their little tiffs and fights. So there was a time that we weren't speaking. During that time that we weren't speaking, he had a breast lump. And I thought that was so weird for him to tell me that, because he had a fibroid lump that had to be taken out of his breast. So I asked my sister, who's a nurse, and she said, actually, that's very common. Men get breast cancer. Men actually get breast tumors. And so that was just so weird, because almost every person in my family, male or female, has gotten some kind of breast masses. And so it does run in the family. But that's your that's your cue as a male person watching this. Check your breast, because you never know, you also could have breast cancer. Anyway, normally I am pretty conservative in the way that I dress. I usually wear clothing that covers my body. I have always had large breasts. And so even without the mastectomy implants for symmetry, naturally I have large breasts. A lot of times I wear bohemian dresses that cover my body because I don't always want the attention of people staring at my breast. But because I am going through breast health conditions, purposely I'm wearing things that are revealing my breast, because breasts are nothing more than an appendage from the body. It's only sexual if you make it that. Now, my breasts really, have not been of any use to me. I've never been pregnant, so I've never nursed a baby with them, which is their intended usage. Now, knowing me, because I'm such an animal lover, had I been able to make milk, I'm pretty sure that I would be nursing kittens and puppies or any other starving animal in the world that needed to eat. But, I don't date a lot, so it's not like I use my breast a lot for that. But, if I did have a date or I did meet a future person in my life, I would still want to have attractive breasts. So right now, I think that they're attractive, except that I'm going to tell you that, like I said, the mastectomy implants that are in them now, they have completely ruptured. So everything that you see on this outside, all of this is my natural breast. But I do have a problem. One of the implants is bunched up and it moved over to the side of this breast. So it's made my breast kind of bulge to the side over here. Then this breast has been leaking down my rib cage. So I think that the intracapsular condition of it has changed. So I had to put in a breast insert on this breast. Not anything really big, but about probably 1/4 of an inch thick. Otherwise, my breasts are very uneven. So look. So I'm just showing you what I'm going through. This is silicone, and it is very thin. It's very thin. It actually feels like a fillet of chicken. And see, if I take it out, you can see this one looks a little rounder, and then this one looks a little flatter. And I can't do anything about it until I have my breast surgery. So I don't want to run around with my breasts looking uneven. And really, it's not so much that there's such a difference, but it's because this implant has bulged up into my armpit. So this is embarrassing, and I hope they never fall out. But so I have had this in my breast like this, stuffed into the side to make them even. So these are the things that I'm going through right now. And I just wanted you to know that I am a very real person. I would rather just say the truth about everything than to be fake or phony. So my life is kind of like an open book. You may not want to know all of these things about me, but these are things that I want to share because I know that there will be another person out there that is going to have to go through the same thing that I'm going through. And I want you to know that not everybody thinks in a conventional way. Not everybody thinks, oh, I'm just going to agree with what the doctors say. I'm going to just, cut off my breast because somebody in my family had cancer. First of all, I would never do that. Even if I would have had, a family history of cancer, I don't agree that people should just, without any symptoms, go cut off their breasts to save their life. I think that that's silly unless you have an issue. Then you can make that decision. But even with finding multiple masses in my breast, my mother did not choose breast surgery. She did not have a mastectomy. She chose radiation. Now, I saw the devastating effects of radiation. It's like being burned. I don't think that I would want to do that. And there's already things that you have to think about. Like right now, I just want to hurry up and I just want to have these implants removed, and I want to put another implant in and be done with this surgery. But of course, then I have to think about if this is cancer, or if I have so many cysts or fibroids in my breast, are they going to tell me that there's going to be a delay in replacing the implant? I mean, all of these things start just running through your head where you're so confused and you're so just worried about, well, oh my gosh, I want to just get this over with. I just want to get it over with. And it's not like that at all. It's very delayed, and you have to go through all of these things. And like I said, you may not agree with your health practitioner's recommendations. And if you don't agree with them, you may even have to find another surgeon. There's so many things that it entails that it's just devastating. I'm glad that this month, like I said, the month is only halfway over. I've already had to shell out $1,500 for co-pays. Thankfully, I have a very kind landlady who's in her 90s. She's a Filipino woman. I know her entire family. I've worked with her family over the years at various places. They're always like, you're such a good person, Brasky. You're such a good person. And we know that you're going through a health crisis right now. So don't pay the rent on the 1st. Pay it at the end of the month. We trust you. We know you're a good person. So it's by grace that I'm making it through the month. I'm so thankful for grace and for good people. I really appreciate that. That makes this so much easier for me. So anyway, I'm sorry that I took a long time to explain this to you, but say prayers for me tomorrow that whatever the diagnosis is with this test, that things are going to go smoothly for me, and that I will be okay.